Our lecture today is shedding or exfoliation of deciduous teeth. Definition of shedding. Shedding is a physiological process lead to elimination of deciduous teeth to allow for eruption of their permanent successors. By terminology, it's either shedding or exfoliation. Significance of shedding. First, deciduous teeth cannot withstand the jaw growth from child to adult, so another set of larger teeth must be needed for large jaw. Second, a growth of masticatory muscles lead to increase their force of mastication in which deciduous teeth cannot withstand their force, lead to trauma to their periodontal ligament, so another set of larger teeth must be needed. In this picture, the child is with exfoliated or shedding of lower central incisor tooth. Pattern of shedding from general view. Shedding of deciduous teeth results from progressive resorption of their root with degeneration of periodontal ligament. Resorption of the root means cementum and dentin was carried out by multinucleated giant cells, which is called Odontoclast cells, which resemble the Osteoclast cell present in the bone. Odontoclast cells are similar histologically to Osteoclasts, as we said. Pattern of shedding depend on the pressure generated from the growing permanent successor. Firstly, the permanent successor produces pressure on the bone, separating it from the deciduous root. By the action of osteoclast cells, this bone will be resorbed, leading to bone resorption. Then the permanent successor become facing the deciduous root and act to resorb root, mean the cementum and dentin of this root directly with elimination of the periodontal ligament occurrence. Initially, the permanent anterior teeth develop in an apicolingual position to their deciduous predecessor. As we said before in previous lectures, we said that the permanent anterior teeth developed in the location lingual to the incisal edge. Then the position of this tooth when the eruption of deciduous teeth occur, its position is located in the apicolingual direction. Then movement of permanent anterior tooth go in a labio-incisal direction, as we said. So resorption of root of deciduous anterior teeth occur in apicolingual surface. Then the anterior deciduous teeth shed with labial portion of root remaining and intact pulp chamber. As we seen in this slide, this is the deciduous central incisors, erupted tooth, and this is the permanent central incisors in eruption process or eruption phase of eruption. This tooth, the root of this tooth is formed, and this tooth will induce pressure on the root of the deciduous central incisors. This resorption occurs in the cementum and in the dentin, and the pressure increased with the increased active eruption of this permanent successor, and the resorption will occur here and continuous here, and all the resorption of cementum, dentin, pulp, and also sometimes part of the enamel occur here. So this tooth remain only the labial portion and small amount of crown, so this tooth will be shed. Shedding of mandibular anterior teeth may be the canine. At 5 months of intrauterine life, this is the advanced stage of this tooth, with the formation of the dentin beginning in the incisal edge. At birth, this deciduous tooth is in the eruptive phase, and the permanent successor in a pre-eruptive phase. This eruptive phase by the formation of the root and complete crown formation of this tooth, and beginning the tooth in active eruption in this direction. At 1 year, the deciduous tooth is still in eruptive phase, and the permanent successor is in pre-eruptive phase by the appearance of the crown formation of this permanent, and in deciduous, the fusion of the reduced enamel epithelium which cover the enamel space here, which is fused with the oral epithelium for eruption of this tooth. After 2 years, this deciduous tooth in eruptive phase also, but the tooth is inside the oral cavity with function, and the root of this tooth is still not complete apical formation yet, so this tooth is in eruptive phase, while the permanent tooth is still in a pre-eruptive phase because the crown is still not complete yet. By the part of the enamel is mature by the formation of enamel space, and part of the enamel is immature by presence of enamel matrix here. At 3.5 years, the deciduous tooth is in post-eruptive phase. Why? Because the complete formation of the apical here, and the permanent tooth is still in a pre-eruptive phase, but the crown is complete formation. At 4.5 years, the permanent tooth is in eruptive phase by the beginning of the Hertwig epithelial root sheath so the formation of roots begin. So this tooth will exert pressure on the apical region of the deciduous anterior tooth. So there is a at the beginning the bone resorption by action of osteoclast, then the resorption of the cementum and dentin, and also the resorption of the pulp and periodontal ligament occur here. Pattern of shedding of deciduous molar. By eruption of deciduous molar, premolar become light apical to deciduous in their divergent root. A premolar produces pressure on the root of deciduous tooth, leading to root resorption of the deciduous molar. Period of root resorption was alternated with a period of rest. At period of rest, repair of deciduous root may be done by deposition of cementum-like tissue in permanent or the pressure exerted by permanent premolar take rest time. At this rest time, the deciduous root of molar may done by deposition of cementum-like tissue. Repair occur in the deciduous root of molar teeth by the formation of cementum-like tissue. So the loose deciduous molar become rigid again. Root repair may lead into ankylosis of deciduous tooth by the formation of cementum-like tissue, which cause the fusion with the permanent crown tooth. Continuous resorption occurred until the root become completely lost and the deciduous molar shed. This radiographic picture shows this is the second deciduous molar, and this is the second premolar. So this the crown of this premolar is located between divergent of root of the deciduous molar, and this tooth will exert pressure on this root of deciduous molar and cause resorption of this root, and then the resorption continue until the resorption occur here, and this tooth will shed, and this tooth will be erupt later. Shedding of deciduous first molar. A newborn, the formation of the crown of deciduous first molar, and at 9 months after birth, this crown is complete and formation of the root occur here. At 1.5 years, this tooth will be complete crown formation and root formation occur here. In 2 years, the formation of permanent crown premolar against lingual to the deciduous molar tooth. At 3 years, this crown will be located between the diversion of the root of deciduous molar. Also at 4.5 years, the crown of this molar will begin to mature by the formation of enamel space here and this tooth in function. At 11 years, this permanent premolar will exert pressure on the root of this molar deciduous and cause resorption of this root. Then at 14 years, the eruption of permanent premolar occur after shedding of the deciduous molar. Histology of shedding. Shedding of deciduous teeth include root resorption and degeneration and degradation of periodontal ligament. Root resorption, increased force of mastication, lead to trauma to the periodontal ligament, which induce root resorption by differentiation of cell termed previously as odontoclast cells. Then degeneration and degradation of periodontal ligament occur. Odontoclast cells is a multinucleated cells responsible for root resorption, origin from blood monocyte, fusion of many monocytes. This formed the multinucleated odontoclast cells. Function of the cells is root resorption during shedding and resorption of remaining root, include the pulp and periodontal ligament. Site on the it's located on the root resorption in depression termed Hawshyp lacunae, same as the osteoclast cell present in the bone, within root canal and pulp chamber. So also it present in the root resorption and also present in the root canal and pulp chamber. This is the histological picture, shows the dentin surface, and this is the Hawshyp lacunae of these odontoclast cells present in the surface of the dentin and cause resorption of this dentin, and this is the pulp adjacent to the dentin. At light microscopic, the odontoclast is shaped as large multinucleated cells, about 8 to 20 nuclei. Cytoplasm, acidophilic cytoplasm, mean red in color, appear at light microscope. Cell contain acid phosphatase enzyme, collagenase enzyme, and protease enzyme. Acid phosphatase enzyme to degrade the hydroxyapatite crystals or inorganic component of the hard tissue like dentin, cementum, or enamel, and collagenase enzyme to degrade the collagen fibers present inside the dentin and the cementum, and protease enzyme to degrade the protein present inside the hard tissue component. This drawing picture of odontoclast cells, this is the multinucleated nuclei, and this is the cytoplasm with increased vacuoles, and this is the ruffled border, which is adjacent to the hard tissue, which cause resorption in this area. At electron microscope level, the odontoclast cell appear with little rough endoplasmic reticulum and Golgi complex inside its cytoplasm, with the numerous mitochondria that produce citric acid and lysosome, with the ruffled border of the cell facing the resorbing root appeared as striated. This is the ruffled border or striated border of these cells. And function of ruffled border, increase the surface area of the working side. This appear as the ruffled, not straight, because to increase the surface area of resorption in this area. A clear zone, this is the clear zone, is the region of cytoplasm adjacent to the ruffled border, are not contain cell organelles mean not contain rough endoplasmic reticulum or Golgi complex, but contain actin and myasin for adhesion of the cells with Hawshyp lacunae. This is the area adjacent to the Hawshyp lacunae, which is a bay inside the dentin or cementum when this cells is located inside it. Odontoclast similarity to Osteoclast, as we said before, Odontoclast is similar to the Osteoclast and differ in some point. The similarity with Osteoclast include large multinucleated giant cells of variable shape, occupy resorption bay or lacunae, which is called Hawshyp lacunae, show ruffled border and clear zone perpendicular to it. Cytoplasm adjacent to ruffled border show high amount of mitochondria and vacuoles, as we seen in the previous slide in electron microscopical picture. Acid phosphatase activity within vacuoles, a process of resorption similar by the degradation of inorganic matrix, which is hydroxyapatite crystals, and then degradation of collagenous protein and protein present in the organic matrix, and then take this component to the bloodstream. Similar origin, both of them from circulating monocyte, and a fusion of these monocytes formed Odontoclast and Osteoclast. What are the difference of the Odontoclast from Osteoclast? In smaller and contain fewer nuclei. Odontoclast is smaller and contain fewer nuclei than Osteoclast. Produce smaller resorption bay, a small Hawshyp lacunae, resorb dental hard tissue, dentin, cementum, and enamel, while the Osteoclast is resorb the bone tissue, seen therefore on surface of dentin, cementum, and enamel, while the Osteoclast seen near the bone when there is resorption, which are to be resorbed, seen also in pulp chamber and root canal of the resorbing deciduous teeth, while the Osteoclast we can see it inside the pulp chamber or root canal. This is histological pictures of shedding element after the anterior tooth is shed of deciduous anterior tooth. Only the part of the crown remain and with a pulp chamber, and this pointer is adjacent to the Hawshyp lacunae of these Odontoclast cells. So the most of coronal pulp is intact in this area. Most of the pulp chamber remain. Dental hard tissue resorption. A. Dental hard tissue decalcification mean removal of cementoid by action of cementoblast cells, removal of calcium by the action of acid phosphatase enzyme and citric acid secreted from Odontoclast cells. Then the organic matrix degeneration, collagen breakdown into protein occurs by the action of the collagenase enzyme secreted from Odontoclast cells also. A protein breakdown into amino acid by the action of a protease enzyme secreted from Odontoclast cells. Then the clearance of this material, the degradation, a product of hydroxyapatite crystals and the organic matrix, and where the waste product into bloodstream by the action of blood monocyte. Dental soft tissue degradation, degradation of periodontal ligament and pulp. Process of degradation of these soft tissue. Dental soft tissue degradation occurs by the way of apoptosis, which means physiological programmed cell death. So the cells inside the pulp and periodontal ligament will be programmed cell death and apoptosis or dying of these cells. The degraded part of the pulp is only facing the resorbing area. The remaining of the pulp include pulp chamber is normal as seen in the previous histological pictures of the shedding anterior tooth. Clinical consideration. First, retain deciduous teeth. deciduous teeth may be retained for a long time beyond their usual shedding time. Such teeth are usually without permanent successor, or their successor are impacted, maybe a congenital missing successor, or the successor is impacted as seen in the impacted canine. They are invariably out of function. Retained deciduous teeth are most often the upper lateral incisors, less frequently second permanent premolar, especially in the mandible, and rarely the lower central incisors. So the most retained deciduous teeth is the upper lateral incisors, second permanent premolar, and lower central incisors. If the permanent tooth is enclosed or impacted, its deciduous predecessor may also be retained. This is most frequently seen with the deciduous and permanent canine teeth. If the permanent lateral incisor is missing, congenital missing, the deciduous tooth is often resorbed under the pressure of the erupting permanent canine. This resorption may be simulated with that of deciduous canine. So the action of permanent canine is cause pressure on the deciduous upper lateral incisor if there is congenital missing upper lateral incisor. So this causes pressure on both lateral incisor deciduous and deciduous canine. This photographic picture shows the retained deciduous tooth here and here. In this picture, this retained deciduous teeth is seen because there is congenital missing permanent premolar here with short root, and this remain as retained deciduous tooth. And in this picture, there is retained deciduous molar because the permanent successor of permanent premolar is impacted here. This is retained primary tooth. This is the retained lower central incisor tooth, and this is the permanent central incisor tooth located lingually. So we must extract this deciduous tooth to permit this lower central incisor to align in this direction before cause crowding if the eruption of the permanent teeth occur, and this they cause need orthodontic treatment. Second clinical consideration is submerged deciduous teeth. Trauma may result in damage to either the dental follicle or the developing periodontal ligament. If this happens, the eruption of the tooth ceases and it becomes enclosed to the bone of the jaw. Because of continued eruption of neighboring teeth and increased height of the alveolar bone, the enclosed tooth may be either shortened or submerged in the alveolar bone. Submerged deciduous teeth prevent the eruption of their permanent successor or force them from their position. Submerged deciduous teeth should therefore be removed as soon as possible. This is the submerged deciduous molar, and this is also the submerged, while the adjacent tooth is taller than this crown. So this submerged tooth must be removed and to allow the permanent successor to erupt in this direction. Third case, clinical consideration, remnant of deciduous teeth. Sometimes part of the root of deciduous teeth are not in the path of eruption permanent teeth and may escape resorption. Such remnant, consisting of dentin and cementum, may remain embedded in the jaw for considerable time. They are more frequently found in association with the permanent premolar, especially in the region of lower second premolar. This radiographical picture shows the remaining root of the deciduous second molar adjacent to the root of the permanent premolar. This remaining root must be removed by surgical removal. The rule of 4 for permanent tooth development, third molar not included. At birth, first molar have initiated calcification of the crown. At 4 years of age, all crown have initiated calcification. At 8 years, all crowns are completed. At 12 years, all crowns emerge. At 16 years, all roots are completed. This aids you to remember the chronology of the permanent teeth. We have rule of 6s in dental development. 6 weeks old in intrauterine life, beginning of dental development by the formation of dental lamina of deciduous teeth. At 6 months old, emergence of the first primary tooth, which is lower central incisor, deciduous tooth. At 6 years old, emergence of the first permanent tooth, which is the first permanent lower molar. That all for this lecture. Thank you for listening and goodbye.